Hello friends, welcome to Easy Nurse, where nursing education made easy. So in this session we will be discussing regarding medical surgical nursing 2. So in this session I have selected the most important question that can come in the exams. Okay, 10 marks, 4 marks, 2 marks and fill in the blanks and all. Okay, so let's just dig into the session. So the first question is, this is a scenario based question which will come in your exams. Okay, so first question is, our patient is Mrs. Meena, who is 52 years old and suffering from post-menstrual, she is a post-menstrual woman, like age is 52. Okay, and present with a painless lump in her right breast. Okay, so as you know, the menopause meaning or the definition of menopause is when the menstruation will be over for a woman. Okay, whenever she will go upward of the age of 40 to 45, okay, or more than 50, then the menstruation cycle will be permanently turned off. Okay, or it will not happen. The ovaries of the female reproductive system will not produce any kind of ovum. Okay, that is called as menopause. So the patient's parents so the patient is present with a painless lump in her right breast. Okay, and we have to discuss the nursing assessment, investigation and management plan for the patient. Okay, so as we know, there are different types of complication come when the menopause will start, because again there is a huge change of hormonal imbalance and balance inside the female body, right? So because of that there is a chance of getting breast lumps. Okay, and due to that the patient can get breast tumors or breast cancer. So in those cases what happened, doctor usually tell the patient, to do breast self examination at least once in a month, okay, or twice in a month. Okay, so as a nurse, what are the things we can do? First one is history. So we have to ask the patient from which day she started feeling the lump. Okay, she is able to recognize that there is a lump in her breast. Okay, also we have to know when the pain have started. Okay, so lump duration, pain, any kind of discharge from the from the nipples or not. Okay, it can be blood, it can be mucus like discharge, or any discharges are there from the nipples or not, that we also have to consider. Then the family history, whether they have in their family, like their females and all, okay, their mother or their grandmother already had this kind of problem or not, that also we have to search. Then we can go for, like, previously she had any problem with her breast or not, that things we will see. Okay, excuse me. So next we will go for inspection. Okay, inspection is nothing but the visualization. So we will see the size, shape, nipple retraction and skin dimpling. Okay, so in the breast we will see the size of the breast. In that case we will see that whether the two breasts are similar size or one is way too bigger than normal, okay, or than the other one. Okay, so in this case the woman have the right breast cancer, right, or right breast lump. Okay, we can't consider it as cancer until and unless we are doing biopsy and diagnose. So we have to see that whether it is whether the right breast is more bigger than the normal size or not, okay, than the left breast. Okay, then the shape of the breast, okay, whether extra lump is present or not, any nipple retraction is there, okay, or skin dimpling. Okay, so these things we will inspect. Then in the palpation we will see the consistency, mobility, tenderness, axillary lymph nodes. Okay, consistency and mobility is quite sometimes it will be normal only, but in the cases of lump there will be seen as tenderness. Okay, tenderness nothing but the hardness and the painful sensation. So as we have already seen, the woman already have the pain, okay, in her right breast, so she will definitely feel the tenderness. Then axillary lymph nodes in the armpits, and especially in the right armpits, because the women have women have the breast lump in the right breast, right? So we have to see the axillary lymph nodes, whether they have whether they have increased, okay, whether they have swollen or not, any kind of discoloration of the particular skin area or not, that we have to see. Then psychosocial anxiety and fear of cancer. Okay, psychosocial assessment also we have to do. We have to give the anxiety, we have to release the anxiety of the patient and fear of the cancer. Then investigation. In the investigation cases, first one is the clinical breast examination. First of all, we know what is self breast examination. Okay, so we know what a person, okay, or female who will self examine her breast to see any kind of changes or abnormality is present there or not. But in the clinical breast examination, what happen is the person will lie down, and there will be a gynecologist, okay, or female doctor that they will examine, okay, whether there any kind of lump is actually present or not, okay, and what is the size of the lump, and they will try to understand. Okay, then mammography, it is a visual examination of the breast. Ultrasound of the breast, okay, then fine needle aspiration cytology, or we can also call it as biopsy. Okay, so where what will happen, they will they will take some tissue from the breast lump and send it to the laboratory to analyze whether this is normal tumor or normal cell growth or normal lump or not, or whether it is a cancer cells. Okay, so these things they will do. Then hormone receptor testing, okay, they will do estrogen, progesterone and all. Okay, these things they will diagnose to understand what is the condition of the lump and what is the category, whether it is tumor or whether it is a cancer. So how we can manage? So first thing we have to do is pre-operative teaching. If the operation is needed, if this is very harmful, the tumor or whatever the breast lump is, if it is a cancer also, if it is very harmful for the patient excuse me, if it is very harmful for the patient excuse me very sorry guys. Okay, so in the cases of operation, we have to teach the patient, we have to tell, like we have to give the emotional support, psychological support, and we have to educate the patient what they're gonna do, okay, how they're gonna remove the lump, okay, what are the complications that can come after the procedure or after the surgery, if surgery is planned. Okay, then support during the chemotherapy, because it's kind of a painful procedure, okay, in the cases of cancer, and chemotherapy drugs are very they are very bitter in taste, and there are also like some injections are there, drug injection, which are while giving they are very painful for the patient to take. Okay, so in those cases we have to support the patient emotionally and physically both. Then pain management of the patient, emotional support to the patient, and health education of breast self examination and follow. So see, in the cases of breast tumor or breast cancer, that can be repeatedly, that can happen, okay, because of some genetic issue or because of the body structure that the woman have, okay, it can be repeated. So in those cases we have to give a proper health education to make the patient understand what is the condition, how to follow up, and if there is any small lump also, how she can self-examine her breast and able to understand before coming hospital, like early diagnosis she can do. Okay, so we have to teach the patient. So this is about the breast lump or breast cancer, you can say. Okay, so there are different types of breast cancer present based on the position and all. Okay, one is malignant and one is benign. Okay, benign is non-harmful and malignant is very harmful. Okay, it is life-threatening. So this is about the breast cancer. Next, we will move on to the nursing management of acute myocardial infarction. So what you know by myocardial infarction? So someone will say heart attack, okay, or someone will say stroke, but it is what actually is, I will tell you. In heart, when the blood flow will not be able to, it will obstruct, okay, or it will not able to flow properly or flow at all, then the shock the person that will go is called as myocardial infarction. So it have acute and chronic. In the acute stages, patient can get a heart attack but still can live, but in the chronic cases, 99% of the cases, the patient will not live anymore. Okay, so that is myocardial infarction. It can be caused, it can happen because of many things. Okay, because of diabetes, excessive adrenaline or dopamine rush. Okay, because of excessive fear of sudden something. Okay, because of accident or out of physical trauma, anything, because of anything it can happen. Sometimes it is also based on gender. Especially you may have heard that the boys are getting nowadays more heart attacks than the women's. Okay. Excuse me. So there are different factors, depend on that myocardial infarction can happen. Next is immediate care. So whenever we are seeing a patient, okay, like you are sitting on a desk, okay, you are sitting on a nursing station, and suddenly a patient come with a myocardial infarction, okay, or a patient in front of you was fine until in between 5 minutes he or she got the acute myocardial infarction. So what is the immediate care that you will give? First one is we have to administer Mona. What is Mona? Mona is the a drug, short form, you can say morphine, oxygen, nitrates and aspirin. Okay, so oxygen here is given not as a drug but as a respiratory support. Okay, and morphine, nitrates and aspirin are the most important. This is also in the crash card you have seen. Okay, you may have seen that crash card. Morphine, nitrate, aspirin, also adrenaline, these drugs are always present. Okay, because they are the emergency drugs. So we have to administer the Mona or morphine, oxygen, nitrate and aspirin. Then ECG monitoring. How we will do? Like after settling everything, we have to do the ECG as soon as possible. Then IV access for emergency drug. Okay, we have to do the IV cannulation as soon as possible. So because the patient must be in unconscious situation, okay, or patient must not be in their stable state. So in those cases, what we can do we can pour the medication inside the IV fluid and we can administer it directly. Then oxygen therapy, as I told. So after the immediate care, what we have to do is ongoing monitoring. Okay, so ongoing monitoring like vital signs and oxygen, like temperature, pulse, oxygen level in the blood. Okay, SpO2 is SpO2 and all, and oxygen saturation. Then 96, like 90 to 100 is fine. Okay, actually 96, but for the case, patient, in the cases the patient just got myocardial infection, 96 or 90 is fine. Okay, 90 to 100. Okay, it should be the saturation of oxygen in the lung. Then continuous cardiac monitoring. We have to see the rhythm of the heartbeat and what is the normal rate of the heartbeat. Then monitor for complications such as arrhythmias or heart failure. Okay, if the patient got relief or patient is already recovered from the acute myocardial infection, you may have given the myocardial CPR and all, everything you may have given. but still there is a chance just after that the patient can get any kind of complications such as arrhythmias and even a heart failure. So we have to keenly observe the patient and we have to record each and every changes of vital signs of the patient. Okay, then is nursing excuse me. Next is nursing intervention. So what are the nursing intervention or what are the actions that we can take? First one is positioning. We have to position the patient in the semi-Fowler's position. Provide the calm environment to make the patient calm, to normalize the blood pressure, okay, and to give the comfortness to the patient as much as possible. Then administer the medication as prescribed, okay, like antiplatelets, thrombolytics. Why it have been given, to decrease the amount or decrease the chances of getting blood clot in the heart. Then encourages bed rest and patient and family education after the post myocardial infarction care. Okay, so this is the answer of the nursing management of acute myocardial infarction. So you guys have understood, right, like what is myocardial infarction and how you can handle as a nurse. Okay, if you have any doubt, comment box is there, you can ask me there. Okay, I will guide you. So let's move on to the next question. That is, a patient has been admitted with extensive burn over 30% of the body. Describe the stage of burn injury and nursing intervention in each stage. Excuse me. So due to any kind of heat, it can be chemical heat, it can be physical heat or radiation heat, if the skin is getting burned, in that cases we will call it as burn. Okay, so in this cases our patient got 30% burn over the body. Okay, so what are the stages? So the stages of burn injury include, first one, emergent destructive phase, okay, which is 0 to 48 hours. So in the 48 hours, like 30% burn, it will be first degree or second degree. It will be second degree burn. Okay, so the second degree burn, okay, in the first phase of second degree burn, we have to give emergent or destructive phase, which is 0 to 48 hours. In between that, we have to maintain the airway, breathing and circulation. Then fluid resuscitation, okay, in Parkland formula. So as we know, while the burn will happen, it can damage the layer of the skin. Okay, so in those cases, body fluid can be released from the body. Okay, so dehydration can happen. That's why we have to maintain the fluid resuscitation, okay, in Parkland formula. Then pain reliever medicine also we have to give to reduce the pain. See, in the cases of third degree burn, usually doctor will not prescribe any pain medication. Why? Because they will that burn, because of the burn, the internal skin, okay, epidermis, every layer will be up to subcutaneous layer, it will be burned. Okay, and in those areas our nerves ending are there, okay, and the nerves are already damaged, so the patient will not feel any kind of pain. So that's why we will not give any kind of pain relief medication for the patient, but because of it's a second degree burn, we will give the pain relief because of the blisters, pain of the blisters, or because of the burning sensation and all, we have to give. Then acute phase, which is after the 48 hours or up to the weeks, okay, or 1 week or 2 weeks, we have to give a proper wound care. Now see, for the burn patient, if it is a normal cut, I have a normal cut over here, over my wrist or over my hand, okay, I can clean with Dettol or cotton swab, okay, or I can clean with gauze piece. But in the cases of burn, what happen, if if it is a second degree burn, you will not able to proper you can't able to do proper dressing. Why? Because patient will feel the extensive pain. Okay, so in this cases we have to give the wound care properly and also infection control. Then nutritional support such as high protein with high calorie foods and all. Then physiotherapy also we can give. In some cases the patient are not able, or for the bedridden patient. Okay, then rehabilitation phase. So what is the rehabilitation phase? In this process we have to prevent the contractures. Psychosocial support we have to give, like for some patient maybe some body part area which is exposing, like hands or maybe legs or maybe face have been burned. Okay, so patient sometimes they can feel the underconfident, okay, and they can feel very inferior. So in those cases we can give the psychosocial support. Then scar management and counseling is also very much needed for the patient. Okay, so as a nurse, now we have known that what are the management that we will do, like from when the patient is getting admitted up to the weeks and months. Okay, but now as a nurse what you will do? First one, we have to do a sterile dressing changes. Okay, so as the patient is already admitted, we have given the proper medication and all, we have to do a sterile dressing change. Okay, in between every 8 hours at least. Okay, so there will be no growth of microorganisms, and also the patient will not get any infection in those areas. Then monitor the so we have to monitor the output of the urine. Okay, then we have to prevent the pressure ulcers. Okay, because the patient will be always bedridden, they can't move everywhere. Okay, so in that cases we have to give the back cares and all to prevent the pressure ulcer. Then emotional support to the patient. So as a nurse these things we can do. Okay, so this is about the burn. The next is the patient 23 years old reports vaginal discharge, itching and lower abdominal pain. So by listening these things, what you can see, like what is the main symptoms? The main symptoms are vaginal discharge, itching and pain in the lower abdomen. So these are the most common usual symptoms of UTI or urinary tract infection. In some cases the first phase of the STD or sexual transmitted disease. So as a nurse, explain the syndromic management and prevent the health education that you will provide to your client. Syndromical management that we will do, like syndromical management in the sense symptoms based management. First one, vaginal discharge is happening, so what we can do, identify the syndrome, vaginal discharge or genital ulcer. Okay, then we can give the combination treatment without waiting for lab result. Okay, combination treatment, in some case antiviral, antibacterial treatments are together. Okay, that we can mix up and give as per the doctor prescription. Then we have to administer antibiotic as per the protocols, okay, after the lab results. Then educate on partner treatment. Now see, in some cases how girls can get the UTIs, okay, or why it is actually happen. So UTIs are also called as urinary tract infection, can cause because of the improper maintaining of hygiene, okay, not using proper not using the proper pad disposal techniques, okay, or not using the personal washroom, using the public washroom without any safety and all. Okay, in that cases that can happen, and STD also can happen in the cases of multiple sexual partners, okay, or not using of barrier method like condoms and all. Okay, so these are the main cause of getting a UTI or sexual transmitted disease. Okay, so for that we have to, after the lab result, we have to tell the patient what exactly happened to the patient. Okay, STI or sexual transmitted infection or urinary tract infection. Okay, we have to tell the patient regarding that, whatever the hygienic measures, whatever the food diet and whatever the safe sex method that is there, okay, that they have to follow, that also we have to share. And also we have to inform the patient, like until and unless that is properly cured, they should avoid the intercourse. Okay, then preventive health education. What we can give, first one is use of condoms, safe sex practices, complete antibiotic courses for the UTIs or STIs, whatever is there. Then regular checkup at least in between 1 month, and in between also they can check up if there is any kind of usual thing that is happening. Then avoid self medication. Okay, without prescribing doctor, they should avoid the medication. So this is the management and preventive health education of UTIs or sexual transmitted disease. Then we have describe the nursing responsibilities and precautions during the care of patient who is undergoing the chemotherapy of cancer. So as we already know how we can give the how we can give the care, psychological support in detail, we will know it. Okay, so before chemotherapy is called as pre-chemotherapy. Okay, as a nurse, what we can do, first one, we have to explain the procedure and the side effects of the chemotherapy, because in 99% of the cases patient will lose their hair, the skin color will be changes, there will be dark circles, sometimes they will feel vomiting, nausea, giddiness and all. So we have to explain the procedure and the side effect. Then check the lab reports such as complete blood count, then renal and liver function. Then we have to ensure the IV accesses. Okay. The next is during the chemotherapy we have to monitor for extravasation, use of proper personal protective equipment such as gloves, masks, goggles, cap, boots. Okay. Then observe for allergic reaction. In some patient, after getting the chemotherapy, patient can feel the allergic reaction. So in that cases, we have to observe that patient for any kind of allergic reaction such as rashes, okay, or vomiting, giddiness, okay, excessive vomiting and giddiness, or any kind of itching they're feeling, or swollen of the lymph nodes. Okay, these things we have to see. Then after the chemotherapy or post chemotherapy, we can manage the side effect like nausea, hair loss and fatigue, infection prevention such as neutropenic precautions, then emotional support and counseling to the patient, then nutrition advice such as soft and high protein diet. The next one is discuss the nursing management of patient with leukemia. So what is leukemia? Leukemia is the other name of the blood cancer. Okay, include the assessment, finding, treatments, modalities and precautions during the chemotherapy. So cancer of blood or bone marrow with abnormal white blood cell growth is called as leukemia. There are different types like ALL, AML, CLL and CML. Okay, so what are the signs of leukemia? Leukemia, if a patient is getting leukemia, okay, sorry, if a patient got leukemia, then the symptoms, the main symptoms that will present are fatigue, fever, bleeding, infection and bone pain. So see, most of the cancer signs, it will be visible or it will be recognizable after some years. Okay, and when it is gone again when it will go on second, third or fourth stage. Why? Because cancer, it will invade in other organs and then only it will show. So in the case, and except the cases of biopsy and all, or the cancer checkup and all, if anyone is getting the cancer also, they will not able to recognize in the first stage itself. Then diagnosis, what are the diagnosis you can do? We can do the complete blood count to understand the abnormal blood cell count in the blood, and bone marrow biopsy. What is the treatment is there? Treatment is chemotherapy and bone marrow transplant, but there is no proper 100% cure is present in the cancer cases. Then nursing care, we have to prevent infections such as aseptic techniques and maintaining the hygiene. Then bleeding precautions such as soft toothbrush and avoid injections. Then nutritional support such as high protein and calorie diet. Then emotional support and counseling also we have to give to the patient. Okay, so as a patient education, we have to give the medication adherence, like when to take, how they should take it after ending, or after the checkups and all, how they have to collect their medicines and all. Then infection signs and regular follow-up also we have to explain it to the patient. The next one is describe the types of glaucoma, its clinical features, diagnosis, nursing responsibilities in the care of patient with glaucoma. So what is glaucoma? It is actually a eye disorder, okay, or eye disease also you can say. Glaucoma is a group of eye disorder causing the optic nerve damage due to increased intraocular pressure. Okay, so continuous intraocular pressure can cause glaucoma. There are types like open angle glaucoma or angle closure glaucoma. Open angle glaucoma will be increased day by day, and angle closure glaucoma is sudden. Okay, the causes are age, family history, diabetes and steroids. The symptoms are blurred vision, halos or eye pain in angle closure glaucoma. How we can diagnose this? We can diagnose this through the tonometry, okay, which is eye pressure measurement, and ophthalmoscopy. Then treatment include eye drops, laser and surgery. Nursing care. The nursing care include administration of medication, monitor the side effects, teach the patient how to use eye drop technique, then promote the adherence and regular eye exam, prevent blindness through the education. Okay, so this is the case of glaucoma, and this is how we can treat the patient. Our next question is explain in the detail the cause, classification and nursing intervention of patient with fracture. So we know everyone, like most of them, got a single fracture at least. Okay, so what is that? A fracture is a break or crack in a bone. So there are different types of fracture are present. Okay, so what is the main cause? Because of any physical trauma, falls, accident, okay, or osteoporosis or weak bones. Then pathological fractures due to cancer or infection. Then classification. So there are different types of bone fractures are present. First one is open, which is compound, okay, which is very complicated. In those cases bone will be outside of the skin, okay, and the bone protrudes through the skin. It will, like, if it is my leg, okay, and if it is breaking, if it is up to this, then it is fine, the bone is inside the skin. But when the bone will be throughout the skin, okay, it will be an open injury, then it will called it as open or compound fracture. Then closed, which is simple fracture, the skin remains intact. Then complete fracture, the bone will breaks completely. Okay, so there are some bone fractures with what will happen in that I will show you. See, so in this case what happened, this bone is completely broken, okay, but in some cases that can happen is in some cases what can happen, maybe this is your bone, okay, so just only a slightly it have been broken, or a thin hair like fracture is there, not fully broken. So there are also different types, okay. So when a bone will completely broke in two parts, then we will call it as complete bone fracture. Then incomplete, the partial break like green stick, as I told you. Okay, so this is the classification of bone fracture. Then what are the clinical manifestations, like what are the symptoms? First one, pain and swelling. Okay, pain at the fracture site, swelling and bruising, deformity or loss of function of that particular area, and crepitus, which is grating sound. There will be cracking or little grating sound if you will try to use that particular part of the body. If your hand is broken and with that hand you are trying to do something, in that cases you can able to hear the tributers, okay, or grating sound. Then diagnostic tool. What are the diagnostic tools that are used to diagnose the fractured bone? X-ray, confirm the type of location of the fracture, and CT scan if in the complex fracture is suspected. Then nursing care. What are the nursing care that we can give as a nurse? Immobilization and pain management of the patient, which is very needed. Okay, then neuromuscular assessment, prevention of complication, and patient education. The next question is, explain the type, causes and nursing care of the patient with otitis media. So what is otitis media? Otitis media is nothing but it is an infection of the middle ear. Okay, so there are three types of otitis media: acute otitis media, chronic otitis media, and serious otitis media. The main causes of the otitis media is upper respiratory tract infection, allergies, and esophageal tube dysfunction. Okay, so see, otitis media especially happen in the children, okay, or toddlers. Usually it does not happen in the adults, but in some cases you can see. Okay, so as a nurse, what we can do, like if it is a bacterial infection, as per the doctor prescription, we can give the antibacterial drugs. We have to clean the patient's ear, we have to give the pain medications and all. Other than all that also, we have to administer the prescribed antibiotic and analgesics for the pain and the infection. Then warm compress over the ear to reduce the pain and swellingness and give the comfort to the patient. Maintain ear hygiene like cleanliness and all. Okay, then educate not to insert any object in the ear. Monitor for complications such as hearing loss or mastoiditis. What is mastoiditis? It is a bone inflammation inside the ear. Okay, so this is the types and the care. The next is types and signs of skin infection, okay, and nursing care of fungal infection. So there are different kind of infections that are present. Okay, so as we know, there are bacteria, virus, fungi. So because of these three, there and parasite infection is also there. Okay, so there are bacterial, viral, fungal and parasitic infection. Bacterial infection example as impetigo or cellulitis. Viral infection caused because of bacteria, which is herpes simplex or chickenpox infection. Then fungal such as tinea and candidiasis. Then parasitic example as scabies or lice infestation. So the main and the common signs of any kind of infection is redness, swelling, itching, pus formation or discharge in severe cases, scaling or any kind of blisters in the skin. So as a nurse, how we can take care of a patient with this kind of infection? First one, keep the affected area clean and dry, not moist. Okay, because in the most of the cases like bacteria, virus, fungi and parasite will grow in the moisture. Okay, so we have to avoid the moisture. The area have to be clean and dry. Apply antifungal powder in the fungal infection or antifungal creams in the cases of fungal infection. Then promote the proper hygiene and changes the clothes frequently of the patient. Educate the patient not to share towels or clothes. Encourage the completion of treatment of or course of the patient. Okay. The next one is conjunctivitis and its nursing management. What is mean by conjunctivitis? So as we know, our eyeball, this white layer is called as conjunctiva. Okay, whenever it will get any kind of infection due to microorganisms, it will called as conjunctivitis. Okay, it is the inflammation of the conjunctiva caused by bacterial, viral or allergic agents. So what is the signs and symptoms of conjunctivitis? redness of the eyes, watery or purulent discharge. Okay, you can see, mucus like discharge or white discharge from the eyes. Okay, or continuous watery eyes, then itching or burning sensation in the eyes, and gritty feeling like something is there present in the eyes. Okay, so that are the main signs and symptoms of conjunctivitis. Then nursing management. Apply prescribed, as a nurse we have to apply the prescribed antibiotic, eye drops and ointment as per the mentioned hour. Okay, clean eyes from inner to outer canthus using the sterile swab. Like we have to take we have to give the proper eye care to the patient. For that we have to prepare everything. We have to wear gloves. Then we can take a forceps, we can clench it to the cotton swab, we can dip it into the solution, IV solution or antiseptic solution. Then we have to clean the eyes from the inner canthus of the eyes to the outside. Okay, to the outer canthus of the eyes. We have to use the sterile swab and we can clean. Then encourage the hand washing to prevent the spread, and before touching eyes especially they have to wash their hands. Okay, then advise not to rub eyes or share towels with anyone else. Then isolate if contagious, like bacterial or viral type of eye infection. Then role of a nurse in disaster preparedness and emergencies. So an emergency tried. So in the cases of emergency, whether it is man-made or whether it is natural, how a nurse will respond. Okay, so disaster preparedness, participate in mock drills and training. Okay, so what is the mock drills? Like if it is any kind of war situation, so before the war, the government will share, how to be safe. Okay, how to escape from the situation. That are the mock drills training actually. Okay, so in those cases we have to participate. Then maintain the emergency supplies and get to the vulnerable people. Then educate the community on disaster response. If any kind of disaster response what to happen, like dry food they should carry. Then they have to not panic. Okay, they have to they can use their mobiles to share their locations, or they have to call the emergency helpline numbers. Okay, so that is how we can teach the community to respond in any kind of disaster. Then no disaster management protocols, like what are the things have to do, what are the things they should follow. Okay, so that is disaster preparedness. Then emergency triage. Okay, emergency triage are apply the start triage program. Okay, simple triage and rapid treatment. So prioritize triage based on the severity. Okay, so based on the severity of the disaster we will treat. Okay, red is immediate needed, like it is life threatening situation and all. Yellow is delayed, like it can be delayed after sometimes you can give the help or treatment whatever is needed. Okay, it can be delayed, but red is not able to be, you can't delay, you have to give the immediate care because the patient life is in danger. Then green is for the minors, like the children's. Okay, or we can say for pregnant women. Okay, then black, which is dead or non-salvageable. Okay, so this is the emergency triage. And also we have to provide the psychological support to the persons and document and communicate clearly during the disaster. Next is hemophilia. Okay, so what is hemophilia and what is the precaution and nursing care? So hemophilia is actually a genetic disorder where blood does not clot properly due to deficiency of clotting factors. Okay, so it is a genetic disorder. Example as factor 8 in hemophilia. Okay, so to avoid hemophilia, what are the precautions that we have to maintain? First one, avoid any kind of trauma or injury to the patient, because that can lead to bleeding. Okay, more blood will loss and you will not able to stop the blood. Okay, naturally, and in that cases the blood level will be low, right? So we have to avoid trauma or any kind of injury. No intramuscular injection unless it is very essential. Then avoid aspirin or non-steroidal anti-inflammatory drugs. Use of soft toothbrush to prevent gum bleeding. Okay, so the hemophilia patient, they are very vulnerable, like with a small trigger also they can get the bleeding. Okay, next is nursing care. Okay, so as a nurse, what we can do, we have to administer clotting factors replacement, apply cold compress for the joint bleeds. Okay, then monitor for signs of internal bleeding if anything happened. Okay, like black stools or hematuria, like blood with urine. Okay, then educate or educate on the injury prevention and emergency signs to the patient, so that the patient also can handle the situation. Okay, so these were the most common long essays that can come in your exam. Now we will discuss some short essays. Okay, or 2 marks question. First one is define breast self examination. This is the most common question. This is already have been given for 6-7 times. Okay, so breast self examination is a technique where a woman examines her own breast regularly for lumps, changes in size, shape, or any usual sign detects the breast abnormalities at early stage. Then second, what are the symptoms of scabies? Intense itching, especially at night, red rash with small blisters, okay, and thin burrow track in the skin, particularly in skin folds like the fingers. Okay, in the fingers or in the underarms you can see the scabies if it is happened. Then the name 2 national programs for communicable disease control. Okay, this is very important. 2 time it already have been came. Okay, so devise National Tuberculosis Control Program and National AIDS Control Program, or NACP. Next question is, what is the syndromic management of sexually transmitted disease? Syndromic management in approach where patients are treated based on the identified symptoms patterns, okay, which is also called as syndromes, such as vaginal discharge, genital ulcers, without waiting for laboratory test. Then mention 2 complications of untreated glaucoma. First one is irreversible vision loss. The patient will be completely blind. Second one is optic nerve damage. The next question is define osteoporosis. As we know, this is also the cause of bone breaking, okay, or bone fracture. So what is the definition? Osteoporosis is the skeletal disorder where it is characterized by low bone density or low bone mass and deterioration of the bone tissue. The bone tissue will be destructed, okay, leading to increased bone be very fragile. Okay, the fragility will be increased and risk of fracture. They will be spongy bone. Okay, they will also called as spongy bone. Excuse me. Next is name 2 symptoms of tonsillitis. Tonsillitis is nothing but it is an infection and inflammation of the tonsil gland. Okay, first one is sore throat and second one is difficulty in swallowing. Then list any 2 common cardiovascular disorder, hypertension and myocardial infarction. Mention 2 common causes of conductive hair loss. First one is impacted earwax, or impacted means it will be there present, like it is not cleaned properly, or in some cases where it is properly clogged. Without clinical visit it can't be removed. In that cases it can happen. Okay, or otitis media or middle ear infection in the chronic cases, or mastoiditis also. The last question is, what is the function of the bone marrow? The bone marrow is responsible for producing the cell inducing red blood cells, white blood cells and platelets. Okay, so bone marrow is the one actually to say who is producing the blood except the plasma. Okay, next we will move on to the fill in the blanks. Okay, the causative organism of tuberculosis is called as Mycobacterium tuberculosis. So what is the most common site of breast cancer? Okay, the upper outer quadrant of the breast is the most common site. A patient with myocardial infraction is commonly given dash to relieve the chest pain. So as we know, there is MONA, okay, where O is deleted because it is oxygen, okay, then morphine, okay, atropine, everything is there. So here we can give morphine. Then what is the use of what is actually used to assess the burn injury in terms of body surface area? So we know the rule is called as rule of 9. Okay, so which vitamin deficiency may lead to night blindness? So we know it is vitamin A is responsible for that. And syndromic management is commonly used for the dash diseases. It is specially used for the sexually transmitted diseases. Then the burden scale is used to assess the risk of dash. Okay, so burden scale is mainly used to understand the risk of the pressure ulcers. Then the chemotherapy drugs are administered through dash route. So it is mainly administered through the IV route or intravenous route. The ringing sound on the ear is called as tinnitus. Okay, so these are some common fill in the blanks I have discussed. In the next upcoming live also we will discuss many more topics. Okay, so do not worry, wait for the next one as well. Okay, the next one is true or false. Okay, just guess it. Okay, try to guess it. Okay, first one is tetanus is communicable disease. Is it true or is it false? Yes, it's true. It can transmit through the bloody fluid and all. Okay, then carcinoma of the breast always presents with pain. It is false. Sometimes carcinoma can be, it can be without pain as well. Only lump will be there. The patient will feel the lump but not the pain. Then alopecia is abnormal growth of hair. Not alopecia is actually hair loss. Okay, excessive hair loss. So it is false. Glaucoma is caused by increased intraocular pressure. We just have heard. Yes, it is true. Then HIV can be transmitted through mosquito bite. This is false. HIV can only transmitted through the blood fluids, okay, or body fluids. No, but not by sweat. Okay, body fluid like plasma, blood and all, semen, okay, this kind of body fluids. Then myocardial infarction is also known as heart attack. It is true. The nerves play a role in disaster management. It is false. So nerves play no role in disaster. Obviously, it is false. Next is psoriasis in an infection of skin disease. This is true. This is false. This is actually an autoimmune disease. Then a tracheostomy may be performed in an airway emergencies. This is true. In the tracheostomy care, what happened actually is the patient, with severe problem of their mouth and all, we can give the tracheostomy feeding or tracheostomy medication administration. So tracheostomy may be performed in the airway emergencies, okay, where from the mouth it is not possible to give, or from the nose it is not possible to give the oxygen or treatment. Okay, next is otitis externa affects the outer ear. It is true. So I have discussed like most all of the question from your chapters, which are the most important seems to me. But let's just discuss in the next session what are the other important topics as well. Okay, so I hope you guys have understood about this session. If you have any kind of doubts or any kind of worry about your any topic, you can ask me in the comment box. Okay, thank you for the session, guys.